welcome, ladies and gentlemen, to the second of Two Geezers and One Care Plan with me, Mark Turton, and
me, Damon Habin.
So if you don't know me and Damon, we both work for in Lincolnshire for a care association. We're both very passionate about adult social care and what it means to an industry which is, I suspect we'll be talking over the next sort of year, the great changes it's going to come across. For those who've not followed us on LinkedIn, I used to do a little questions and answer session for about 12 months, of which it grew in popularity. I just came up with a couple of questions, and then I just sent it out into my groups, and the groups just expanded, and they just sort of shared and answered the questions as we went along. And Damon's been a big follower of that. And one of the things Damon has got is he's got a very good social media involvement in his communities, and also especially around digital and especially around cybersecurity. So this is where we came from. Before we get on to, we're going to do two questions and we're going to do two tips through the next hour. So I'm going to throw a little curveball in as what's Christmas or this time of year mean to you, Damon? This is not the main question, Damon.
I think it's easy. I think it's family. That's what it means to me. To quote Dom Toretto, it's all about family. What about you, Mark?
I agree. I think it is family. I think it's also a time of reflection.
Yeah.
Someone very dear to us, one just said that more decisions are made by business over the Christmas period than any other time of the year. And that's when family business sit down and say, right, do we want to go on? What do we want to do? And I think ultimately, there's that element of professionalism. I think definitely my take on this time of year has changed as you get older. And that comes with, responsibility, and especially family. I think you're right with family. I think family is so important. And I think it's also that time of year, where communities and different communities actually can come together in harmony, and we see that within adult social care. We see that played out time and time again with testimonials we get from individuals who work in adult social care about what they've given up, in the sense of giving up time to do things differently and to help others in greater need. And then we've got those people who are actually requiring care, and the wonderful staff which actually give up a day in a way, especially on Christmas Day, to prolong the element of independence for that individual. So I agree with you, and I'm very much a big believer in families. I'm a big believer in keeping everyone safe, and it sometimes is very, very difficult to do that sometimes. And I look at that as as both us two are fathers.
Yep.
And then that, I think, is important. But also, I put a little thing is, why do we want to work over this period of time?
I think it's one of the most rewarding jobs, isn't it, within social care and within the wider healthcare system. And I'll never forget the transition on the days I have worked on actual Christmas Day, from the almost dread, if I'm honest, of like, I've got to leave the family and go out and support people, to the actual then going out and doing it, and just that amazing feeling that you get, delivering support work, or any sort of support within social or healthcare. That's just amazing. But I think that doing it on over the holidays, it just adds that little bit more, and then it just reminds you of why we do what we do within this industry. So yeah.
So I think someone at work said to me the other day, said, Mark, why are you working through Christmas? And I says, well, it's probably the only time of the year I feel I can give and feel honest about this and say, right then, I'm more than happy to work to allow you time off with your family. And we're going back to families again, aren't we?
Yeah,
And,
yeah,
and
yeah,
we know I've got a couple of people in our office who've never ever had Christmas off because they've worked in other parts of industries
yeah,
where they have to work Christmas Day. And I
yeah,
know for myself, working as a nurse for many, many years, Christmas Day was quite a special one where you worked it, you might not work it, but you always looked at the off duty come early December. Are you working Christmas New Year?
yeah,
And working Christmas Day was to me was quite nice.
yeah,
It got me out a lot of the little chores I had to do, like help the prep for
yeah,
Christmas morning. And then we historically as a family we've always opened presents in the afternoon, never in the morning. So that it wasn't an issue. So I used to put myself down for an early on Christmas Day, get the excitement of being with the patients I was looking at, and then spending the afternoon rest of the day, and then back in on Boxing Day mostly. So, but I think I look at some of the people in our team and they say, really, yeah, you can have Christmas off. Put it down as your annual leave. You can put it off, and I think that sometimes is they think it's reward. I just think it's just me being as manager saying, look, um, it is a quiet period,
yeah,
Christmas, and between Christmas and New Year for definitely for emails. My emails have dropped off the cliff at the moment, and I've got the on-call telephone at the moment, and I think I've had one inquiry, touch wood, since Christmas Eve,
mm,
and that was around billing and something around billing which I couldn't resolve, but I've just posted it onto someone else.
yeah,
Who and I'm thinking, if we're quiet, what's the world like? Because the world still goes revolves, isn't it?
yeah, yeah, yeah. Especially in retail and social care, and there's still stuff happening. I've enjoyed sort of this quiet time. You mentioned one of the keywords earlier, reflection. It's good to have a little bit more. I mean, we're busy all year round, but it's good to have that sort of time, just take a breather, but also get some jobs finished, and get prepared for the new year. Um, yeah, looking back at what we've done, but also more towards what we're doing, and a little bit of plan and preparation.
Yeah, I was in the office yesterday, and it was nice that our executive chair popped in because
Yeah,
she was doing a piece of work in the other office, some peace and quiet, I think she said. And it was nice to have a catch up with her in a formal place rather than informal place rather than a formal
yeah,
place. And I think
yeah,
that's sometimes nice. And she just looked around and says that this office is normally heaving, and it's just you, Mark. It's just weird.
yeah,
He says it's
yeah,
weird. He says all I could see was the balding chap behind a monitor tapping away. And he says, oh, she thought she was laughing. She says, Mark's busy. I said, I'm always busy, man. This element. And then we'd already spoken on Teams already because we live in
yeah,
different parts of the county of Lincolnshire. So therefore, and I know you were busy, sort of in that sense. Yeah, I
yeah,
totally agree. I think it's a good period for reflection, but tying up a few loose ends.
yeah,
I've been able to sort of do some spreadsheet design just to start things for the team. So one of the things which we won't be talking about on this one, we might be talking about on future ones, is about impacts.
yeah,
So as you will know, Damon, I've sent out an email to all the senior team members of the team I oversee to ask them about what they think their achievements have been this year
yeah,
in 2025 and what they think they would like an impact into 2026, and put a KPI scoring mechanism alongside it. And that I have to stick my hand up. That comes courtesy of artificial intelligence and support of that. And that's something we've talked about and we will talk about constant, I think, on these, is how much AI influences and will influence strategy and processes going forward, and how best we can we work with it, but also control it. I think the mechanism. Right then,
yeah,
let's get started. So the first question, and the first question I'd like to ask to you, Damon, is New Year. We all look at it's tradition, New Year resolution.
yeah.
So related to your work, and the sector you are homing in on specifically. And I
Yeah,
know, and I'm pleased to say, just on this call, Damon's going to be heading up a really massive piece of work in the East Midlands around digital security, specifically around quality markers,
yeah,
especially in Nottinghamshire and in Derbyshire and in Lincolnshire.
yeah.
So looking at what's your big change in your resolution? What's your big ticket item you think is gonna fall on your desk? And probably just to give you a bit of irritation is what's the fear?
Cool. Well, I think the resolution is to get us. The challenge is always 100%. And is that achievable? Well, if we don't aim for it, we're never going to hit it. But I think the resolution is to not just continue the growth of Lincolnshire's uptake of the DSPT, the Digital Security Protection Toolkit, but as you mentioned there, support both Nottingham and Derbyshire. Their numbers are slightly behind us, but it's the different counties, the different dynamics. And it's a new team. The team that's outgoing were fantastic, had great working relationship with them, um, and it's taking the new team that one step further. And I think I'd just like to see what we've done this year. Really proud of the team, the whole team, and I think that we've made some real huge leaps and bounds with the stuff that we've done, and continue that momentum. The fear, as the percentage grows, we're currently sitting at just under 90%. As that percentage keeps growing, sorry, I said 90%, 80%, I should say. As we beat that 8%, grow towards the 90%, and beyond, it does get harder because you've got to maintain those that have done it previously and support them to complete it again. Some providers now, it's just natural, they do it. Others, I remember when Leicester County Council had a cyber attack. So you're hot on it. You mentioned about social media, get stuff out there. You engage with providers who haven't maybe completed the DSPT and say, what have you got in place? Especially with Leicester having a cyber attack, and how that affected social care providers. Some of them weren't paid. And it's very hard times. And some of the responses were, well, we're not in Leicester, it doesn't affect us. And it's like, no, it doesn't today, but God forbid it did. What have we got? And I remember from our first podcast, my top tip was around business continuity planning. So it's twofold. It's getting more providers to complete it, but also getting more providers, not within necessarily Lincolnshire, Nottingham, or Derbyshire, just throughout the country, maybe seeing as DSBT as a tick box exercise. I've ticked yes to everything, therefore I'm compliant. It's more than that. It's it's actually following it and putting into practice a lot of the guidance, all of the guidance. But I think that's my New Year's resolution. But I say the fear is it does get harder. But always very positive, and always half glass full. So I don't like to use terms like hard to reach or more difficult providers to engage with. It's just that I've got to change the way that I engage and make sure that I meet people on their terms and their understanding, to support them.
I think you made some really interesting points. I think the biggest point to me is the growth of cybersecurity education has gone universal, I think, over the last 2 years.
Yeah.
I remember when DSPT first came out, it was, what is it?
Yeah.
How can we sell this to people? And the feeling is now that there's more a conversation around, why shouldn't I not do it? Rather than why should I do it? Does that make sense?
100%, 100%. It should just be natural. And I think 2025 was the year of AI. I don't. I mean, obviously, it's been around for decades. But I think yet last year it just exploded. Well, this year, still this year, it just exploded and became something of a behemoth. And I think it's had such a massive impact in the world, let alone our own sector. Um, but cybersecurity should and is, but should become, like we leave the house, we lock the door. We get out of the car. I mean, to be fair, now we get out of the car and it locks itself. We don't even have to do that. But it's making cybersecurity just natural. It's we do something, we make sure that we've got a good password on it, or we take things a little bit more seriously. And they're such simple little steps, but they have such a massive impact. And I'll never stop bleating on about it, because it is just doing those little simple things can make such a massive difference. But we can't stop doing it. I remember doing one of the courses, one of the many courses that we do, and somebody asked, will the criminals use AI to attack us in better ways? Yeah. And I use the Digital Care Hub. There's some great people there, use some of their knowledge rather than trying to second guess or come up with the wrong answer. Went to them and it's like, yeah, of course they will.
But on the other hand, would you get the other way around? Would AI help protect you against cybersecurity? I'm thinking, who's to say in a year's time DSPT can be done by AI, and therefore all the provider has to do is press the AI button on, say, Copilot, and could you please do analysis of my digital cybersecurity toolkit, please, DSPT, and it's there, it's done. But it will come back, and the good thing, certainly, the way I've used AI recently is around impact, and I use impact assessment tools to basically, where are the holes in my project, in the sense that we're looking at some project works I've been doing, but where is, and it comes, but I have to say the impact risk assessments, which I have seen and used, I mean, mightily impressive.
Yeah, it's just a fantastic tool, isn't it? And it can be a force for good. It should never replace human beings, and still we need to just always double check and read things, because it can get it wrong. But something that's exciting for this year as well, certainly for Lincolnshire providers, is working with KK Secure, which was previously Crypto Cloud. We're going to have our own sort of portal where providers will be able to basically upload or basically upload their DSPT into it, and they've got it's more than AI, but the ability to basically score their DSPT, and as you just pointed out there, highlight where they're going well. So that's the positives, but also here's some gaps. But it still means, as for all of us, we can be told a number of times and we can be shown a number of things, but if we don't want to or don't wish to or can't be bothered, as I look at myself in the camera, I keep thinking, is this the year where I finally get out and do some exercise and lose a bit of well-needed weight loss, but only ultimately I can do that. I can get all the advice, I can get all of the tools and the equipment. If I don't choose to, then it's personal choice, isn't it?
It certainly is. And I think it's an interesting. I think there's some interesting concepts there, specifically around change management. And especially around, but also, I think adult social care itself enjoys having a bit of chaos management as well. We like throwing. The fact is that we don't know what today is going to look like, and when it does, and it turns into total chaos, we still manage it well, and we still come out with some kind of output which actually is positive. I just think that there's fantastic opportunities, and I'm sure there's providers out there already looking at this specifically and say, right then, how can we do things differently? How can we actually just make it simpler? I'm just one of the big fundamental tick boxes I always thought needs to be addressed is how do we match cybersecurity into the core requirements for um, um, making safeguarding personnel. And so therefore, if we looked at it in the other way, in the other factor is that if you have got information about a said individual in your care and you lose that data, whether it is someone written it onto a piece of paper at handover period and it's got lost, but there's so much information on it, that would be classed as a safeguarding breach.
Yeah.
So why can't we do something similar? Why can't this element of this new domain of actually cybersecurity be added into safeguarding for protection and into actually AI? Well, I won't call it AI, or just call it tech protection, technology protection, and of which we are then, if my feeling, if that is the case, if you went down that avenue, then there's a requirement under CQC, the requirement of both the Care Act, and if CQC is involved, the Health and Care Act, those two very important acts of parliament for our sector, and therefore we are liable and we are responsible as providers to do something about it. And that will lead to, I think, the 100% we're driving for DSP. Does that make sense?
It does, 100%. And it should all go. I mean, one of the highlights of 2025 was I feel, I'm sure that we were a digital minded team before 2025, but last year things seemed to fall into place. And just doing things like our newsletter, which has got links to our guides, which has then got links to the workforce development, rather than being and being a bit self-honest, rather than being sort of semi-siloed, it's kind of like, well, actually, LinCA is such a massive organization that provides a lot of support. It should all just link together and work together, and leading back to the AI, talking to a provider who basically used AI to create a manager induction process, which she then tweaked. She was very honest and sort of said, without that, it had taken weeks to produce it and then run it and then tweak it and then run it and tweak it and run it and tweak it. Whereas now she was more confident. And I look forward and think, well, in 2026, people that have done that sort of work should rather than, I'm not saying that she's siloed, and sometimes, within any business, which we all are at the end of the day, we've got to make sure that we're successful and profitable, as well as providing a great service. But rather than being siloed, sort of saying, well, actually, I've done that, and here, why don't you have that? Or take something from it, or use it as the building blocks for something for yourself to design. And I'm a big fan of that. I look at a lot of newsletters that the care providers produce and think, well, actually, I like some of those little bits, so I'm going to steal those and magpie it and put it in our own newsletter, rather than try and reinvent the wheel when there's something adequate out there. Yeah. Bit of a long-winded answer to a.
No, wrong with that. I think good.
Yeah. So, turning it back to yourself, Mark, what's your work-based sort of New Year's resolution, and of course, why?
I've got three. No, I've got four.
Ooh.
I think the next 12 months is going to be, I think, will define the future of adult social care. Both within my own workforce remit, but also into both regional and national identities. I say that, so one of the big elements we are, and I'm calling the role we, which is the LinCA Care Association, we are starting the long journey of setting up something called a Care Academy, specifically to support care providers who want to improve their workforce but also seek access to the learning development, so the LDSS through the government portal, as well as accessing career pathways and putting workforce at the core element of development, which has always been there, but this
Yeah.
is literally putting on a piece of paper and actually doing something about it. And that is probably having its own workforce planning element to it. So we're looking at having a learning management system involved in that, so providers could purchase and buy into that process. Some care associations nationally are already doing something very similar. Hertfordshire do that really, really well, and have really got a good product on there. So we're following that. There's other care associations, especially in the northeast, are doing something very similar, and so it feels right to do this at the right time. The second element is, for me, is April the 1st. We've got the new workers' rights, and the law related that will come out into force, which I think will change some aspects of our workforce. The big one to me is around sick pay, followed by contracts, especially 0-hour contracts. And then you've got the element around paternity, maternity pay and rights regarding that. The list goes on, and that will eventually feed into the fair pay agreement, which will have further traction, I think, throughout the year. The third element to me is the maintaining of the Skills for Care accredited care workers pathway, something which we've been very proactive into and feel it is the way forward in developing a workforce, both ethically but also systematically, to look at what does the future of care look like specifically, and how that will impact the changing needs of a workforce. So if we look at the NHS 10-year plan, where it's literally care at the front door approach, and the fear is that there's less requirements of residential care. Well, speaking to experts and reading the data, especially across the Midlands, shows that there's still going to be between 7-10% increase in residential beds needed, because sheer volume from the growth of population, especially the elderly population in certain aspects. And we're, as you know, we're in a very rural part of England, where there's a higher proportion of over 85s who actually fall into the remits of needing care and healthcare together. So that desire to migrate into a rural county is still there. The appetite is still there, so therefore the demand will be still there. It's just that commissioners will spend their money slightly different. And I think that gives us an opportunity to look, say, what does the private sector need to do to meet the demand? And that leads us in finally, the other one around you is to fulfill the requirements and understand what in the late 2026 would be the first offering from the Casey Commission. So we know Casey will be giving their first offering to government. We thought it would be summer, but my understanding is that that is not concrete. It's now been put back to 2026, so that could be right up to a year today. It could be released. That's how late, because then they've made the deadline of 2026. So I think, and that in itself as a resolution, is there's going to be a lot of work in corridors of power to get this right. I think this is a generational opportunity to influence change in a positive way. And whatever political equation you believe in, and what changes will happen politically in the next 3 years, this is something which is to say, actually, this is what the sector needs. This is the sector really asks for. But more importantly, to get the financial restraints removed or altered slightly. So actually the deficits between what is a commission bed and what is a private funder, there's no greater emphasis for providers around top-up fees and the extortionary amount. Some care organisations fall foul on because of that. We hear horror stories where delayed discharge comes around because no respect to the social workers, they're who are under extreme pressure in hospital with hospital beds, etc. But actually, they're saying, well, this provider here doesn't have top up. This one does. Which one would you like to push? To contact? And to me, that doesn't give the full picture of actually explain what does a top up really is all about. And that's around the difference between, no respect to the companies I'll be talking about, is between a Premier Inn or the Radisson. If you go to the Radisson, you get that extra quality in a lot of other things. And no respect to Premier Inn, where you can get good quality, and there's great quality there. It's is basic, and therefore you get what you pay for. And the expectations. So it's about how do we meet the expectations for the future. And so I think in 2026, we as a company, we tend to drive around mantras at the moment. So last year was our mantra was always about the art of the possible. This year it's all about the impact, and the word impact. How much impact does it need? How much impact can we see? How much impact will it make? So to me, that's my resolution, is all about how much impact I can put into those four key components to ensure when we're having this chat in a year's time, I can quite happily tick at least one or two of those and said, we've done that really well. I can guarantee and stick my hand on my heart, and there'll be questions I'll say to myself, but we could have done this better for here and here and here. But that comes with experience. That comes with other factors which we will have no control of. But it does come with a risk.
You made some really good points there, and I think that could 2026 be the year that social care not steps out of the shadows of the NHS, but certainly gets a bit more of the light? Because looking at that 10-year plan and the three main pillars, social care has got to be at the front of all of them, really. I mean, the first one, hospital to community, well, that is predominantly us, isn't it?
100%, David. And it's this number of discussions I have in committees with very, very senior people who still can't understand the concept that someone living in a residential home, it is their home.
Yeah.
It isn't a institution. It is their home. They have a front door to their room, and they may be there because they need support. Because they are not totally independent, but it is their home. And my feeling is until they can't, if they get over that concept of actually hospital to home and community, hospital, in that the element of community is that, but then I flip it on, is that, do care providers have to meet people halfway and open their doors more? If they want to be, are they a community? Are they a part of the community? Are they essential to the community? We've got some great testimonials of where that is the case. But then, you read some other testimonials where you think, why aren't you talking to your community more?
And I think that's where we need to shout about successes and share that. I have that privileged position where I get to go and visit providers, and a home over towards the north of the county. They've got somebody there playing on a sort of upright piano. And I just made the comment, that's a talented resident you got there, and it's like, no, that's a member of the public. He comes here twice a week. We give him some lunch, and he plays for the residents, and he enjoys it 'cause it's company and a decent meal, and he gets to show off his talents. And outside they've got an external building that during a period where the local church was having some work done, they were able to sort of support the congregation to have their services there every Sunday. And I think, well, we should not just shout about that within a local area, but actually shout about that across the county and the country, because I think that the people aren't always aware. I think it's the nature of the industry, isn't it? We're very humble about what we do. But given half the chance, having had the privilege of being able to do support work, and that included palliative care, supporting somebody in their last moments is one of the proudest things I've ever done. But it's not the sort of thing you bring up in a conversation to sort of say, because we're humble, we don't want to say, look at me. And I think sometimes maybe social care needs to stop being humble and say, actually, look at me. And I wonder how many people, because I just think it's amazing the work that LinCA does. And of course, I'm going to say that because I work for LinCA. But the bladder scanners, it was something that I sort of heard murmurings of, but wasn't really aware of what they were. And then I saw what they were. And then I saw what we've actually done to support providers and the wider community and the NHS, and all for what I might think's a sum of money, but in the grand scheme of things, pennies. But what it can actually achieve. But then the bigger picture of I used to love it being a support worker, going out and doing a peg feed. And I'm sure a lot of people that may listen to this and go, well, what's a peg feed? Well, Google it and have a look. And then people think, well, that's a nursing task, isn't it? No, I was trained and supported by nurses, but I was so proud because when I looked at it, I thought, well, surely that's a nursing task. No, it's a delegated health task, and with the right training and sign off and keeping competencies up, anybody with the right competency can do that sort of stuff. And I'd love to be in a home or doing domiciliary care now, armed with a bladder scanner. And I think it's just amazing. And on the flip side of that, just we expanded our team in the digital front and had Sean come and work for us, and what one person's managed to achieve, it's amazing. And then you look at it and think, well, what could we achieve with 2 Seans or 3 Seans or 5 Seans?
But I think the important thing there is, so we'd identified as a management team that engagement with providers is the key to do 2 things. One, to remove the barrier of it's not working.
Yeah.
And therefore the engagement officer goes and says, okay, show me it's not working. Let's see if we can solve that. And that literally overnight resolved a lot of issues. To the fact is that some people didn't know how to turn on a simple Wi-Fi device.
Yeah.
It was simply as that. But there was also elements around, your techness isn't working, we can change it. Oh, do you know we could do that? And it's a lot of myth busting. But what we also suddenly said is that what we suddenly found is there was confidence in the market. And so when confidence is there, it just grows. And I agree with you. I think we're at a stage where I'm working with another member of the team to how can we escalate that engagement role to a stage where actually it works for all parts of the business.
Yeah.
And I know going back to DSPT, I think it's a similar model you're going to use across your sphere, because actually it does drive the conversation, but it also drives communication to a level that actually people don't fear. And I think going back to the bladder scanners, just for those who are not aware, in Lincolnshire, we've been looking at delegated nursing tasks now for about 4 years, and we've constantly been hitting barriers. And no respect to our health colleagues, the majority of actually reasons why have fallen into individuals who work in the NHS who really didn't like the idea of social care nurses having the autonomy to undertake a simple task without other responsibilities. And when we pointed out that they've got a PIN, they are a registered nurse, they're right on their register themselves, so they are a professional person themselves. that suddenly we got a lot of traction. Very senior people got involved, and it come down to the fact is who's going to pay it. And we were dilly-dallying for so long about which part of the NHS was going to pay for the bladder scanners. The care association said, "Oh, sod this," in a way, not in that way, but said we
Yeah.
will pay for the first year. So we went and purchased 8 bladder scanners. So it's been fully funded by adult social care. The impact report's been done by adult social care with support from the ICB and through community services in the local NHS services. But we still got some stumbling blocks to go through where individuals in the NHS still are reluctant to take off the handbrake. And, our concept is, why should a nurse enter a nursing home where there's already competent nurses in the establishment, unless those competent nurses who work in social care have requested expert support from the community nurse? And an example, and I'm sure some of our listeners and viewers may well back this, especially nursing care, is that we had a nursing home in one morning had 5 different district nurses attending to do delegated tasks from the same surgery.
Yeah.
And if you looked at that as a time and motion study, you're looking at 5 hours plus travel, plus national insurance and pension, plus equipment, of which you had a nurse already been paid a salary similar in the establishment who could have done that and was willing to do that as part of their care package. So the system to me is just at times, and I'm coming off this as a nurse, a professional nurse myself, is that it feels like it's the right time to have these conversations.
Yeah. Do you think sometimes it's fear of letting go? Because I go back to a conversation that we must have had well over a year ago, if not 2 years ago, about the digital team and expanding it and splitting my role. And my fear was, you have many fears and many things running through your head, but I think the biggest thing for me was I didn't want to let go of what I'd got and couldn't make the choice of what to let go if I had to let something go. And it took somebody bigger and braver like yourself to come along and say, you're doing a grand job, but we want to go to the next level. And to do that, you can't do it doing all of it. So it's not a question of does somebody feel that they're failing if it's taken away and somebody else does it? Because to me, from the outside, looking at that, having worked in other sectors, you'd think, well, we can't run a business like that and keep doing that because it's madness. It'd be like my neighbours just had an Iceland delivery this morning. It'd be like them, doing an Iceland delivery at 9, then travelling to the other side of the town to do one, then to travel back at 10 to do another one here, to travel back. And you wouldn't. You'd do 9, 9:30, 10, or about every 15 minutes here. You'd make it work, wouldn't you? You wouldn't.
But don't you think there's an element of trust as well?
Yeah.
It's. I remember with the conversation I had specifically with yourself, and we felt at the time, I give you the option, didn't I?
Yeah.
I have this vision. I just said to you, I think for the better of the role for you, you need to give 100% on one subject rather than 33% on 3.
Yeah.
And at the time, you were the senior individual, and we're bringing someone in alongside you to support, but specifically on one subject. And I said, look, if I give you 50% and the other person 50%, that means you are going to give a lot more.
Yeah.
And I remember you saying to me, and you were one of the wonderful people in the team, who suddenly turned around and said, I wish I'd said yes 6 months ago, because we've delayed this 6 months now, and I see this. And a part of that is, I look back, did I sell the vision to you correctly? I thought I did, but I probably didn't do it in the way that I just thought, well, I'll just tell Damon he's doing a good job, but I want more from him. The best way to do that is actually not to take the job his other jobs, but actually to explain to him what the bigger picture is, and then let him find the way and the route around it. And it just took us 6 months to get there. I wouldn't change the way I did it and went about it, because I think it was the right way. I was just proud of you that you came 6 months later and says, it was like you woke up and went, why aren't we doing this? And I'm going, David, this is the way forward. And actually, and to me, that is, we look at professional development, and one of the things we want to talk about, the second one is about next year, and especially about impacts. But to me, that was the biggest impact of your own personal development, is that you actually stuck your head up and said, I might have made the wrong call there. And with no, and there was no argument in the fact that I didn't think you made the right call or not. I just looked, I said to you, it's your decision, Damon.
Yeah.
But I believe this is the way forward. And then when you came and said, actually, you're right, I thought that was great for your development.
Yeah.
And I've seen since then, you're a different beast in one say. You've gained more confidence, you're more robust in the way you talk to people, but more importantly, you're focused. You've got a drive, which you probably have always had, but this time is literally, it feels like the shackles are off. I've got this beast in front of me thinking, off you go.
And I think pride gets in the way of doing things, but I think that once we've done it, the pride now of seeing how we're, and it's an ongoing journey. It's one that will, be long and hard, but it's getting there. But also seeing how the delegated healthcare remote monitoring has gone from an okay place to one that's amazing, and it's now having the pride of seeing my area grow, but also seeing what Frank and Sean are doing grow, but how we're growing together. Because there's I think fear, and I think it's fear of change, isn't it?
Well, let's hold that, because I want to bring the
Yeah.
next second question in, because we've only got sort of about 10 minutes. And
Yeah.
that's things about, we've talked about around the beginning about New Year resolutions.
Yeah.
But I'm thinking about, and I'm going to go back to something about co-production.
Yeah.
So my second question is about things we want to do next year to improve adult social care, which decrease a requirement for co-production. So the question to you is, co-production can be lonely.
Yeah.
It's also very scary.
Yeah.
So where do you think we will be without co-production? Let's just turn it slightly to 45 degrees.
Without it, we're going to be worse than we are today. I mentioned, well, you mentioned it as well with what Hertfordshire are doing with their learning management system in place, and how rather than us reinvent the wheel, it's like, well, let's look at what other care associations have done, and we want to do this. We've seen that it's worked in other areas. Let's make that work. I think for us, social care can't do it on its own. The NHS can't do it on their own. Local councils can't do it on their own. But together, we can achieve so much. And I think sometimes adult social care can be the glue in the middle to help things to stick together and work.
I was thinking, David, someone who I used to work for used to call it the kitchen curtain syndrome. So he said that social care are very good at putting the curtains and closing them.
Yep.
And so it blocks the light out and everything in that, and you're working behind the scenes in a silo process.
Yep.
And at various times of the day you might open it slightly, and you let the sunshine in, and things have become healthy. Guess what then we do at night time? We shut them.
Yep.
So, and he said, what we need to do is just take the damn curtains down.
Yeah.
And whether it's dark or light, people can see through. You've got nothing to fear. The only fear you've got if you're doing something illegal.
Yeah.
And you shouldn't be doing it in the first place. And that's down to you as a professional. because if you're doing something illegally, you deserve to get the repercussions, in my eyes.
Yeah.
But if you're doing things well, and I think you made a good point about the fact is how how open are we to someone phoning us up or someone dropping us email saying, "Can we have a discussion? I think I might be able to solve your problem."
Yeah. Yeah. And just getting that across, and not you know, it's like we do lots of little bits, and I nothing makes me feel better where somebody sort of says, well, would you mind if I, like we've done a few little how-to guides, would you mind if I use them? Yeah, crack on. um you know I'm not even that fussed. I don't want the credit for it. Just take the guts out of it and rebrand it as your own. And if somebody sort of says, oh, I like that, please do mention that you borrowed it from so and so. But it's that working togetherness. And I think for going back old grown, but for the 10-year plan, if we don't start working together, if we stay siloed and our little, keep the curtains closed, it's not going to work, is it? And I'd love to see. I look at I look at those three, and I look at how we are within Lincolnshire, and on that digital front. Nearly 60% of providers have got a secure NHS email address. 8% almost have got their DSPT, and 90% nearly have got a DSCR, digital social care record. So the hunger for growth is there. And I don't think that we're a stagnant sector. I think we're looking for growth. But it's that working together that's going to get the job done, if that makes sense.
Yeah, I think so. I think, we do a lot of work with the council, and the big fear was the council Lincolnshire changed colour in the summer, and the big fear was that this was going to be catastrophe and be a major issue. And in fact, we've seen more, no respect to the previous political party, but we've seen more connection with politicians who are willing to listen.
Yeah.
The 2026 is how much listening they have listened.
Yeah.
And then if they haven't, they've got to be held to account. And the only way they can be held to account is, of course, through the ballot box. But what we can't have is something I've written down about disinformation in social media, is the fact that co-production has a part to play in both policing the media, holding media outlets to account for false information, or to say, right, this is my belief, prove me wrong, and let's come up with have a sensible conversation, and an adult conversation to say, right then, where are the facts? I'm a big believer. You show me the facts, show me how it works. I'm more than happy to change the path I'm traveling on if I believe that the final output means that, going back to the word impact again, it will provide an impact which is actually the safest, but more importantly, cost effective, but more and more importantly, person centered. Because we're dealing, adult social care, we deal with the most vulnerable people in society, in my eyes, and therefore we have a duty of care. And how many people forget that by saying or doing things inappropriately, shall we say, on social media as a prime example. And I think co-production has a part to play in is energizing a conversation in a way that we have improved quality output, I think. I know I'm doing a piece of work around CQC recently, and speaking to a couple of people in CQC. They've gone through an immense big change, but the only way they've been done that is through a co-production model. So if an institution like CQC can change or look to change or want to change through co-production, the rest of us need to take note.
Yeah. And I think that's a great example because, you know, it's very easy to give an organization like the CQC a real hard time or a really good kicking sometimes. And like you say, social media, people are very quick to highlight stuff. And I don't think I'd want to be a CQC inspector. You know, you can't win.
They
If
don't
they
get
go in
paid.
and
They
give,
don't get paid enough, Damon.
well, you just think if they go in and give a provider glowing review, you know, outstanding on everything, guaranteed a family member's going to come up and say, "Well, I don't agree with that. I think they're rubbish." You know, they and expectations, or they can go in and just go on a bad day and, you know, um, ruin a provider basically. You know, but they've got to. It's like social workers. They've got to highlight when things are going well and also highlight when things aren't. But if they get it wrong, crikey, they make the front page very quickly. But it's good that they are open. I know from the cybersecurity side, they're very open to that and the digital front, and, you know, promoting that. And they're making all the right noises, and it's good that you know, people like the Digital Care Hub and yourself are being invited to those chats, um, to be a part of that ongoing sort of journey. And I think that's the only way that any of us are going to make any real impact. It's you know, on our own, it's so much harder, isn't it?
Right, yeah, I agree. Right, I'm looking at my figures, so we're coming up to near the end of our hour.
Yeah.
So, top tips. Do you want to go first? Go on. You.
I've got a really easy one, and it it all comes back. I was producing a flyer for an event that we were holding, and you realise that half the day's gone, and you think, "Oh God, it's an A4 flyer." So my top tip is sometimes good is good enough. You know, that search for perfection. Because I and again, the way I work, that producing that flyer, I'd allotted, let's say, 20 minutes, and it took a lot longer than that. So that meant I worked into the evening, my choice. But I wanted to get the jobs I'd got set aside that day finished. And I'd spent far too much time messing around with this bloody flyer. So sometimes good is good enough. With a caveat, one of my own mantras, especially being a father, um, I'm happy if somebody does something, but I'm also happy if they don't do it, with a reason, you know, why they haven't done it. It's that bit in the middle that I just get really annoyed by, where it's that half-assed, for want of a better word, effort, and it's like, well, you might as well have not bothered because you've not achieved what we wanted doing. You've wasted a lot of time doing, you know, something that's rubbish. You might as well just not have done it. So either do it or don't. But sometimes, good is good enough. Yeah. What about yours, Mark?
Right, it's all I'm going to say is, could providers and especially managers stop buying crockery sets? The reason why is I would spend every week talking to people who are spinning too many damn plates at one
Yeah.
time.
Yeah.
And as we know, is the old thing is one that I used to love it as a young kid watching the Generation Game with all, well, Bruce Forsyth, and they used to be have the person spinning the plates because you loved it when one broke, one fell
Yeah.
off, because they take their eye off the ball, and all you need to do is one. But actually, it's easy to keep them spinning as long as you're in touch and you've got enough energy to do that. But to do that over a period of time is very, very difficult. But what sometimes happens is that we get people says, yes, 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 we'll do that, we'll do this with this. So they're buying more crockery sets, more plates spinning, and therefore if you have too many plates spinning, you will fail. So my top tip is, if you want to be a finisher, and most people I believe are heading that direction, which means that you're in control, you are less stressful,
Yeah.
therefore healthier,
Yeah.
but you can multitask in a way that you can control your plates because you've just got enough of them to control. You're not overburdening yourself. Therefore, you'll be focused. And remember, when you've completed one of your plates and it's stable and stops spinning, you can take it off. Guess what? Then you can go to your crockery set and put one more back on. Don't put 5 on at a time. So that's my tip. Just to be aware of how much work you've got. Too many plates leads to problems.
Certainly does.
All right then, Damon, I'll leave it to you to close down the session.
Thank you. Well, I think one last little bit before we close, and thank you for anybody that's got this far. As we talked about, especially with that top tip there, we've got lots of things going on. So really appreciate that people take the time out to listen to us. But I think a bit of an ask would be, as we sort of continue to do these, I think it'd be great to have some guests on. So if anybody's listening and wants to reach out to Mark or myself, we've got a bit of a vetting sort of questionnaire. But we'd love to sort of speak to people and hear why they'd like to join us and what they'd like to talk about. I don't know how you feel about that.
100%. I think to have variety is healthier.
Yeah.
I don't think what our listeners would just want is just me and you talking a lot of nonsense that people might believe or might of great interest, but it may be that to have a third eye, a third pair of eyes to probe and just talk to and say, look, what do you think?
Yeah.
The other thing as well, if anyone would like any questions asked.
Yeah.
What about that one?
Yeah, no, it's good. That's good. Because it's like sort of say, I think that's the issue with anything, and I talk a lot within the team. I'm happy to do things for others, but the thing that we have to remember is if I do something, then it's always going to have my slant on it. And I think with the way that we're asking the questions, answering the questions, it's always going to have our own slants on it. And it'd be good even just to hear from somebody who's listening to things and thinking, well, actually, yeah, hopefully I agree with that. I think you made some good points. You're 80%, 90%, 100% there. But also for somebody to sort of say, no, I disagree with you on that. But not just because that's the downside with social media. It's like, well, you're rubbish. Well, that's great, but tell me why I'm rubbish. Get that interaction. Shared ideas goes back to that collaboration. I think that's the way at the end of the day that we truly get to make an impact in our lives. Sharing and
I think the last thing is just a slight disclaimer. All the views which are both me and Damien talk about are our own personal views, not the views of the organisation we work for. We do talk about our organisation because we're very passionate and very pleased we work for the organisation. So we are very pleased. So we are passionate working on social care. We are planning to do our next session in probably the end of January, early February. Please, if you want to contact us, anything, we prefer to do that through our LinkedIn accounts. So Two Geezers does come out on LinkedIn, and you will very, very shortly, if not already, be able to access it through a YouTube account, which we've already got the first one on there, I think, ready to go as well. So if you do miss us or you hear about us second, third hand, and you want to see two old men talk, or a younger man and an old man, we do look like our pictures.
Yeah.
That's so we keep saying that. As we would notice, it was the two new Ronnies. Hold on.
That's it.
Yeah. Listen, guys, to you, Damon, have a great New Year. See you in the new year.
You too.
I think we are back at work on Friday.
Monday.
Oh, you got Monday? You got Friday off? Oh, no, you don't work Fridays, of course.
Oh, I don't do Fridays.
You don't work Fridays. So, I'm back on Friday. So, I'm back behind the desk. Wishing everyone a happy New Year.
Yes.
And same to you, Damon, and your family.
Brilliant. Same to you, Mark.
All right. Cheers, guys.
Cheers. Bye-bye.